Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. Hypnobirthing is a technique used all over the world to help women manage and enjoy their childbirth experience. Today we'll be explaining everything you need to know about hypnobirthing. So click those like and subscribe buttons and stay with us. So what is hypnobirthing anyway? Hypnobirthing is a method that prepares you for your birth. It uses guided meditation, self-hypnosis, controlled breathing, and deep relaxation techniques to help you to relax and guide your body through the process of labor with minimal pain. One of the things hypnobirthing does is it focuses on a positive birth experience through positive thoughts, words, and affirmations. It trains your brain to elicit deep relaxation responses during the labor process, which creates a very enjoyable and comfortable birth experience. There are many benefits to hypnobirthing. For starters, there's a lower rate of medical interventions, such as using epidurals or anesthesia during your labor. Hypnobirthing has been shown to reduce the use of medications such as Pitocin or cervical ripening agents used to induce labor. There's also a lower rate of cesarean sections when you use hypnobirthing. Finally, hypnobirthing is focused on a positive birth experience, and therefore there's reduced fear going into labor and delivery, and women report that their births were far more enjoyable than they possibly could have imagined. So there aren't actually that many risks related to hypnobirthing, but it is important to recognize that if things don't go according to plan, a lot of women may feel an extreme amount of frustration. They have to throw out the birth plan and come up with a new plan all on the fly, and this kind of goes in the face of some hypnobirthing techniques. So this may cause a lot of distress for a woman and possibly even trauma. Additionally, some women may experience trouble getting hypnotized, which can interfere with the progress of the hypnobirthing techniques. On a practical side, the classes are expensive and they can be time-consuming. So you need to make sure you're finding the right technique, which leads to another issue. There are so many different techniques, so it may be hard for you to determine the technique that works best for you and find a class that works within that technique. Please remember to hit the like and subscribe button so you can get our latest content. Hypnobirthing is a technique that can be used successfully amongst most pregnancies. There is some literature that shows that caution should be used for patients who have gestational diabetes or preeclampsia, depending on what's going on during the labor process. A weakened cervix may also be a type of birth that requires different management, and the mom may not be able to use her hypnobirthing techniques. Some true contraindications can include placental abruption. Placental abruption is where the placenta detaches from the uterine wall. This requires an emergency C-section, and moms are usually placed under general anesthesia almost immediately. Other contraindications can include a history of anxiety, depression, psychosis, schizophrenia, and epilepsy. This is because some of these conditions can be triggered or worsened due to the relaxation techniques. Hypnobirthing utilizes a lot of different breathing techniques. For starters, you can do relaxation breathing. This is where you're breathing in, paying full attention to your breath. And when you exhale or breathe out, you breathe out for twice as long as you inhaled or breathed in. Surge breathing is another type of breathing used in hypnobirthing. This is where you take a deep breath through your nose and release it for the same count. So if you breathe in for 3 seconds, you breathe out for 3 seconds. Now, Also, you can do birth breathing. This is where you breathe in for 2 and you breathe out for 10. While breathing out, you direct your breath downward towards the pelvis, paying attention to that area and using visualization to help it relax. One of the metaphors that I've heard used is where you imagine that the pelvic floor and the vaginal area is a flower that slowly blooms as you breathe out. There is a technique in hypnobirthing that's sometimes called perfect pushing. This is a breathing technique where you breathe in for 2 counts and then you surge breathe out while you tighten your abdomen and push your breath down towards the pelvic floor. The pelvic floor muscles are supposed to relax during the surge downward to help allow your baby to pass through more naturally. One technique used during hypnobirthing is massage. So the first type of massage can be just a light touch, like the brush of fingertips across somebody's back. This creates a tingling sensation which results in relaxation. Additionally, you can continue with a massage in an S pattern, up and down the back. Counter touch is firm touch near the lower back. This provides pressure during the surge of the contraction, which can help relieve pain. You can actually use a tennis ball to help avoid exhausting your arms and your hands by pressing that tennis ball deep into that part of the lower back. The best tips for hypnobirthing start with finding a class and instructor to teach you the techniques properly. You want to start these classes around 25 to 30 weeks of pregnancy so you have plenty of time to learn the technique and practice. You want to make sure you get your healthcare provider on board and make sure that hypnobirthing is okay for your pregnancy and that they're going to support your choice through your labor process. And finally, you need to do your research and make sure hypnobirthing is the right method for you and that you find an instructor who teaches you the techniques that you are comfortable with. I hope this video has helped you learn about hypnobirthing and helped you determine if this is an option for you during the birth of your baby. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest information in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.